Center for Human Development wants you to know that better mental health can be as simple as making a phone call. CHD is offering free phone-in sessions with counselors for anyone in the community who may have a mental or behavioral health question or concern. CHD Vice Presidents Will Davila and Kim Lee came in to tell us what that's all about.
That's really it, Jim. It's getting the word out about CHD's availability of behavioral health or emotional wellness programming is not always an easy subject to talk about. And so we brainstormed at the office and said, perhaps one of the easiest ways to engage people in a conversation around emotional wellness is to offer some kind of a free screening, a mental health check-in, if you will, that we would provide 2 days. The first is March 9th from 5 p.m. to 9 p.m. And then the second is that Saturday, March 11th, from 10 a.m. until 2 p.m. And folks can just simply call our 800 number, the 844-CHD help number, which I'm sure we'll talk about a little bit later, and talk with a licensed, a professional mental health clinician, somebody who is very well versed, very experienced in the field of mental health, mental wellness, emotional duress, distress, whatever it is you might want to call. So whether people are calling in for themselves, perhaps for a loved one, a child, a sibling, a good friend, it really is an opportunity to take a first free, confidential, anonymous step towards getting the help that you may need or a loved one may need for their emotional wellness.
Dr. Will, let me ask you, we talked a little before the camera started rolling, and one of the things you said was, it may seem like an easy thing to do, but making that move, making that call, turning that doorknob, as you put it, not always as easy as we might think.
Right. I think that the biggest problem that we have is being able to connect with folks, with getting them to understand that everyone struggles with some level of mental health, mental wellness. And our whole reason behind doing this is to be able to tell people, even if you're not sure, even if it's not about you, if it's about a family member, call us, talk to us, let us know what's going on. We'll have a few quick questions for you, and we can figure out whether we feel like you should come in and see us, whether we feel like we want to check in with you later on. But it's an easy way to just, as it's called, just to do a mental health check-in with no obligation. It doesn't matter what your insurance is. We just want to have you check in with us, be able to help you figure out whether you need help, whether there's help that we can provide for you. And a big part of it is that stigma, getting people to understand that if you reach out for help, there will be help for you, that's going to come without any judgment.
Kim, an important thing the doctor just mentioned, easy to do, and this is free of charge.
It is, regardless of insurance, Jim. There's no copay, there's no insurance to worry about. It's completely free. CHD is very, very committed to the overall health and wellness of our community, and so we are picking up the tab, the cost to have staff available on that day. Staff are giving up their own personal time, their weekends, to make themselves available for individuals who may be calling in. And it's an important conversation, it's an important event to have, and we're very, very much looking forward to hosting it and to what we hope will be many, many phone calls from people who are just calling to make that first step, just to ask a question or two so that we can help assess where they might be with their own emotional wellness.
And Doctor, I know you mentioned a lot of people can have some sort of mental health or behavioral problem, smoking, an addiction, something they'd like to talk to a professional about, like to deal with. The numbers that Kim sent out with her announcement were absolutely startling. It's estimated by the federal government, 18% of adults, that's about 60 million people, have some form of a mental illness or a behavioral illness. 1 out of 5 children may experience in the course of a year a diagnosable, persistent mental health issue. I had to quote that exactly. Those numbers are startling.
They are startling, but what I think is in some ways more startling is how easy it is for many of these people to improve their lives. I think there are cases in those statistics that are difficult to treat and that are going to be persistent and lifelong for some folks. But many of these mental health issues, many of these substance use issues are treatable. We're not going to have a magic solution that's going to get rid of everything, but getting mental health counseling, getting addiction treatment, reaching out, like I said, will help many of these folks. And so part of the issue that we try to help people understand is that there's a difference between something that's just going to be a single episode or a small issue and something that is creating a difficulty in your life, that's limiting you from really achieving your goals and having a full life. And that's where we want to be available to folks when people are limiting themselves because their mental health is limiting them from achieving their goals, or because their addiction is making them struggle with their job and their home life as parents and as members of the community. That's where we think it's important for people to get help, because just that simple act can have such huge impact on them.
Jim, life is just too short. Life is just too short for us to go through it feeling bad or, not feeling ourselves. You look at the terms, oh, she's a nervous Nelly, or, why is she such a Debbie Downer, or, but there's help out there.
Doctor, let me ask you, what's the follow-up or the takeaway? Someone makes that step to call, and the professional talking to them says, it sounds like you could benefit from further discussion or from a program we know about. What happens then? Are they sent to a website? Are they sent some information? How might that be taken?
They're sent to a real live person. So the way that we're doing this, number one, is that we have these 2 days where we're going to take all the calls that come in, and we're hoping that we get bombarded. We're ready for it, and we want folks to take advantage of it. The people that call in will have several options. Number one is just free advice that they can get in that brief conversation if it's a relatively minor issue. And folks that may call us that may be in crisis, for example, they'll get immediate attention from us. But if we determine that somebody may have something more serious, we're going to try to schedule them to come in and see us with no commitment. Just come in and talk to us face to face, because there's more information that we need to collect before we're able to determine what a plan for treatment might be. The other option is that we say, it doesn't look like there's anything serious here, but just to be sure, let's check in with you in a month. We'll call you if you don't mind, whether it's a month or a couple of months, just to see how things are going and double check and see where you're at. But one thing I did want to go back to that Kim mentioned, we like using at CHD these analogies about physical health, because I think people have such a more honest and accessible attitude about physical health compared to what they have about mental health. So, if I have a problem with my knee, I may ignore it for a couple of days. But if the pain is very severe, or if it lasts a long time, I'm going to want to get that checked out. I'm not just going to ignore it. And I think the same thing goes for the example of, if you're dealing with depression. Depression for a couple of days may not be clinical depression. You may be, just having a hard time that's directly related to something that's going on in your life. But struggling with it for a persistent period of time in a way that may limit your life functions. You may be having a hard time at work. You may not be sleeping enough. There may be all these other impacts that it has on your life. That's more serious, and that's something that if it was a body part, we'd ask you to come in and check it out. And we want people to have that attitude that if you are physically injured, you go without any hesitation, without any embarrassment, without any shyness about it at all, and you get help. And we want people to feel the same way about their mental wellness.
Excellent. Again, the number, it's 844-CHD-HELP. Kim, Dr. Will, thank you both for coming in. Good to have you.